AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and, of course, where we do encourage you to call in and to join in. Today, folks, well, a real special program today. We've been talking so much about ozone therapy, the big O. And the guy that got it all started has been a guest of ours twice before. He will be our guest today, part 3 in the Godfather series, the Godfather of ozone therapy. Dr. Frank Shallenberger is our guest today. He's going to be talking about, well, ozone in general to bring all of you up to speed who may not understand it. Fill in on the last show, which was on what's something called major autohemotherapy, which is one of the primary ways that ozone is given. But the invented form and use of ozone for joint pain and discomfort, well, he's the one that coined it. He's the one that put it into play, and he's been doing it since 1995. It's called Prolozone, and it'll be the spotlight and highlight of our particular discussion with the doctor today. In the course of our discussion with Dr. Frank Shallenberger, you want to call in to ask a question or to make a comment. That number, of course, will be 412-825-6262. That's 412-825-6262. And I'll give that number additionally throughout the hour. Dr. Frank Shallenberger, our guest today. Now, boy, this month of April has started out with a roar yesterday, and I don't know how it went. I hope all of you had a good time here at my office with Susie Weiss doing her essential oils seminar. I'll find out more about that once I get off air today. And, of course, tomorrow, Susie Weiss has her grand conference out at the Embassy Suites at Charrington exit of the, it used to be the old way to get to the airport. It's business route to Moon Township, Embassy Suites. Tomorrow, all day, 10 a.m. to 5 p.m., inviting everybody out there. If you'd like to learn more about essential oils, this is an absolutely free event for you. Please come on out and enjoy the day. I'm going to be there participating. Hope to see you, too. Now, on Monday, and we did some switching around because, next week is the Freedom of Choice in Cancer Therapy group, and is in keeping with the usual format around here, we always like to get the guest of that month on our show on Monday, and we did so. Dr. Thomas Levy is going to be our guest on Monday morning, talking about calcium and how maybe it's not everything it's been cracked up to be. His newest book, Tom Levy, is the featured speaker out of the Freedom of Choice in Cancer Therapy group. That's going to meet on Thursday night, 7 o'clock. The new place is called Riverside Landings. It's right in town, right in the town of Oakmont. Get to that Walgreen, and after you cross the Holton Bridge, turn right. Go out two stop signs worth and turn right again, and you're on Washington Avenue. Don't go too much further than the edge of Washington Avenue. It takes you right to the river, folks. Anyway, see you there. Supposedly a great venue, and what a jam-packed author and really medical brilliant individual Dr. Thomas Levy is. He'll be our guest on Monday. On Wednesday, it'll be Dr. Susan Smith-Jones coming back to talk about spring cleaning your body. Would expect none less from her. And then the following Monday, the 14th, the gentleman we had to switch around is the gentleman who is the number one guy, I'd say, in the country with promoting the use of ultraviolet blood irradiation. Just so happens that the two ozone therapy and UBI, ultraviolet blood irradiation, really go hand in hand quite nicely. And because we'll be doing the combination of both here in the office, I thought that Tom Lowe, who you can check him out at doctorsubi.com, doctorsubi.com, and learn all about what you'd like to hear about with ultraviolet blood irradiation. He'll be our guest on the 14th, which will be like a week and a half away. Then we move into our eye treatment seminar this month, April 15, 16, and 17. It's our 3-day seminar, folks. There's still just about enough time. If you think you'd like to be in the particular program for this month, give us a call at 724-942-3002 so that we can get you enrolled, signed up, and have you get the microcurrent stimulator program by Dr. Edward Condrat. He reviews all charts. He is intimately acquainted with all cases that come here. And this month, 15, 16, and 17 will be the dates. And I think in terms of the active schedule, that just about rounds it out. Those of you with cataracts out there, now you know we launched this month a brand new way of dealing with cataracts through the use of these special drops. These are drops that were originally conceived by Dr. Robert Rowan, an alternative doctor from San Francisco. But once Dr. Ed Condrat, our go-to ophthalmologist, I guess is the best way to put it, put his seal of approval on these as the best way to dissolve cataracts. If it's going to be possible, we jumped right in line. We got the compounding going. And so if you have cataracts, and so many people do, and you'd like to be able to do something about it, get established with me as a patient so that I'd be able to ethically and legally write the prescription so that you can receive those drops. And then you're on a 3-month experiment, I guess is a better way to say it, to see if we can't improve your vision to negate the need for that surgery. You always want to postpone a surgery. Always make it the last choice. Unfortunately, as it stands right now, it's the first choice, and unfortunately, too, the only choice. And so rather than allowing you to proceed to something without other options, we've given you some. And by the way, if that 3-month on the eye drops isn't successful, the 3-day treatment program is step B, plan B, before you ever have to consider surgery also. So there are options. We're presenting them to you. For more on eye issues, give us a call, 724-942-3002. And looks like we have the next eye treatment seminar. The free one that we're going to be offering is going to be here in the McMurray office. It's going to be on May 1st at 6 o'clock. So way into the future, if you think you'd like to learn more about this, we keep offering these various free seminars all over town. The next one we're going to hold is going to be right here, our office, 6 p.m. If you want to be on May 1st, if you want to be a part of it, just dial us up to 724-942-3002. You can talk to anybody with respect to enrolling yourself in the seminar. If you want to talk specifically about eyes and the eye program, ask for Sarah. She pretty much will be able to guide you wherever you need to go. All right. Enough said. I'm getting excited, folks. We're going to take a short break. And in the interim, we're going to go find him, folks. He's way out in Carson City, Nevada, but he was so nice enough to consent to come aboard with us this morning in an ungodly hour for him out there. The Godfather himself will be right back with us, Dr. Frank Shallenberger, our special guest today.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D., is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Always feeling tired, stressed? Do you turn to food to feel better and still wind up tired, stressed, and overweight? We at Avenue to Wellness can help. Using medications and nutritional supplements, we can help you control your appetite, relieve your stress, and give you the energy to enjoy life. These are powerful medications and supplements that only a doctor can prescribe. Dr. Sherman at Avenue to Wellness can create the plan that works best for you. Call 412-646-1063 for a free computerized evaluation. Stop suffering and give yourself the gift of happiness. 412-646-1063. Start on the path to more energy and less stress. 412-646-1063.
620 HP.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Friday morning version of the show. A little bit different for us. It is a special guest today, one that you've met on a couple of occasions prior. This gentleman has such a pedigree and such a fine, established medical career in especially one area that we've been able to benefit from as listeners now, twice out. And as we get to our third one, I know you're very much in anticipation of his arrival today. Because get a load of some of the stuff I want to say about this gentleman here. He's been practicing primary care medicine since 1974. He's trained doctors all over the world in the use of ozone therapy. In 1995, he developed his own technique for treating chronic pain problems, a mixture of homeopathics and ozone. He dubbed it Prolozone. It survives well today, and it's a primary topic of our discussion with him today. Original signer of the Madrid Declaration, that was developed as an international standard for the use of ozone therapy. He, in 2010, established the American Academy of Ozone Therapy and serves today as its first and only president. Author of two layperson's books, Type 2 Diabetes Breakthrough and Bursting with Energy, and then his famous physician-directed book, To the Principles and Application of Ozone Therapy. I'm only halfway there, folks. Get a load of this. He's also, without a doubt, the single most important person who has fostered, nurtured, and shepherded the use of ozone therapy in medical practice in the United States. He's the godfather of ozone therapy. He is Dr. Frank Shallenberger. Good morning, Dr. Shallenberger, and thanks for allowing us to invade your morning once more.
Good morning, Dennis. It's a pleasure to be with you this morning.
I would be remiss if I just didn't take a moment. I got to tell you, Dr. Shallenberger, and I've shared this with my listeners, and I'd like to do it with you on board. You know, we're just about a week ago, we were both together, you and I have attended many a medical conference, but none such as I did a week ago with your third meeting of the American Academy of Ozone Therapy. You have brought together the movers, the groovers, and the shakers of ozone therapy in the USA. Just happens that you trained every single one of them anyway, and you've hatched them out, and they're out there, and they're doing the good work, and they're bringing the information back, and they're sharing it to take a neophyte like myself and allow me to be brought up to speed in a way that made me feel so comfortable. You need to be commended for what you've done. I know that the accolades run frequent when you're involved, but I would be remiss if I didn't mention a thank you from myself and all of my listeners for all the work you've done. Dr. Shallenberger, you're a shining example of a medical doctor, and I just wanted to mention that to you as we begin. Enough of the warm and fuzzies, Frank. Enough of the warm and fuzzies. Look, this ozone therapy, which you have been dealing an entire career with, is intriguing to my listeners. And now that they know that these therapies are going to be available to them when really they've been shut out of this particular therapy for so long. Could you take a moment for maybe those listeners who haven't been aboard with us twice before and just describe, as only you can, what is ozone therapy? What is this thing? Why is there so much excitement about its potential? What makes it so different a therapy? Please.
All right, I'll be happy to. First of all, what the listeners want to know is that ozone it's a molecule made entirely out of oxygen. What it isn't pollution, it isn't a poison, it isn't anything that is going to hurt anybody when it's properly used, any more than oxygen is going to hurt anybody. So that's the first thing you need to understand. Oxygen atoms cannot survive by themselves. A single oxygen atom all by itself cannot survive by itself because it doesn't have enough electrons. All molecules have to have an equal number of electrons and positrons. So, but oxygen atoms don't have that. So what they have to do is they have to pair up with a second oxygen atom. So the two of them pair up and they share their electrons, and that's a nice balanced molecule. That's when you go to the hospital and the doctor gives you oxygen, that's what you're getting. You're getting what we call O2. That's two oxygen atoms together in a very stable molecule. What we do is we make something called ozone by taking O2, passing it through a generator, and in the generator, the two oxygen atoms that are clinging together are converted to three oxygen atoms clinging together. That's what ozone is. So ozone is basically O3. Now so it's O2, it's regular oxygen with a third oxygen atom added onto it. The presence of that third oxygen atom makes the molecule ozone very highly reactive. So that when we interact ozone with human tissues and blood, and in a moment we'll see how we do it with muscles and ligaments and all kinds of things, but when we interact ozone with human tissue, it is a very strong, has an extremely strong oxygen effect. Regular oxygen won't have any effect anywhere near as strong as that. So if we were to use regular oxygen in medical applications, it's helpful, it does a lot of good in a lot of cases, but it's nowhere near as powerful as using ozone. So it's the first thing that the listeners want to understand is that ozone is not a poison. It is, in fact, a supercharged version of oxygen. Second thing the listeners want to remember is that most of the problems, if not all of the problems that people have as we get older, and we're going to talk today about pain, we're going to talk today about joints that go bad, degenerated joints, say like knees and hips and back pains and all kinds of things like that. So I'm including those kinds of problems, but I'm including all the other kinds of problems that people can get as they get older, say diabetes or cancer, heart disease, all these sorts of problems. The core stem reason that people get these various issues has to do with oxygen, has to do with the inability for the body to use oxygen. And the principle to remember is that ozone can fix that. So when the body cannot use oxygen efficiently, applying ozone to it, no matter where you're applying it, what part of the body, etc., is going to heal that particular issue. And that is why the use of ozone in the human body is so effective for so many things. So that gives kind of a little bit of a rundown on what we mean when we use this molecule called ozone.
And that link, that final link that unites pretty much every pathology that we know as doctors and that people have to suffer through as patients, the link of the oxygen utilization happening way down there at the level of something even called a mitochondria doesn't appear to be able to be dealt with in the fashion that ozone can deal with it. And because it's so specific to that, it literally makes ozone a usable item in just about any disease you can name. Is there anything, maybe we should put it this way, is there anything that ozone fails at? It shouldn't be used for. And are there any safeguards for ozone that listeners should know about you talked about it's not the pollution thing. Are there any side effects or risks of using ozone? 2 questions.
That's a really good point. By and large, absolutely. When ozone is used according to the dictates of modern medicine, which I outline in my book, it's absolutely 100% safe. It's the safest thing any doctor can do with you, including giving you an aspirin tablet for a headache. It's absolutely safe. The other thing about ozone is it's incredibly inexpensive. To make ozone is pretty much as cheap as just making oxygen. So it's safe, it's very inexpensive, but people should know there is one danger to it, and everybody in the medical profession recognizes this. You cannot inhale ozone. All body tissues utilize ozone every bit as effectively as they utilize oxygen, with one exception, and that's lung tissue. Lung tissue cannot utilize ozone. The oxygen is way too strong for lung tissue. Lung tissue is designed to use only oxygen in its O2 form. You put O3 in there, you will damage lung tissue. In effect, actually, Dennis, it's not that big a problem, because if anybody were to sniff just the smallest amount of ozone, they would go into a coughing spasm that would dramatically warn them not to sniff anymore. But that's the only exclusion that we make in the human body, is you can't inhale ozone.
Yeah, and emphasize the word inhale, because you can have lung disorders, and they can be greatly assisted as long as you're getting ozone administered any other way other than inhalation. It's that inhalation component that you have to steer clear of. And oddly enough, people who think of ozone think of it being the inhaled substance. And there are so many ways that ozone can be administered. I got a kick out of you telling us, well, hey, just come to my office, and I'll let you take it for a moment, because walking into your office, I've never been there, but it's an ozone experience in just about every arena that's possible. Walk us quickly through the various ways that ozone can be used.
In my office, I have ozone generators almost in every room in the office. We specifically do it and use it in 4 different ways. One of them we're going to talk about today, which is a technique where we use ozone to heal various injuries in the body. And in that concept, we take ozone in a syringe and just inject it or place it in the various parts of the body. The other thing that we use it for is we treat the body systemically, the blood. We treat the blood, so we'll take blood out of the body into a treatment bag. We'll inject ozone, which is a gas. The reader should know ozone's a gas, not a liquid. We inject that gas into the bag with the blood. The blood immediately takes up the ozone. As I said, it's highly reactive. And once it's taken it up, we run the blood back into the body. And so that's another technique. That's sort of a whole body technique. You'll remember just a remarkable presentation from the last meeting where Dr. Simonetti from Italy talked about how successful he's been treating patients with multiple sclerosis using that particular technique, because it treats the whole body. A third way that we use it is in our colonics. I don't know if probably every listener does not know what a colonic is, but a colonic is a way to clean out and detoxify the intestinal system. And so in the process of that, we can inject ozone gas into the intestinal system. So that's another way to treat the body through the intestines and the liver with ozone. And then the last way that we use is through the skin, so that we'll put patients in a sauna type of unit, and in the sauna, their body gets heated up, and ozone gas is administered through their skin. So those are the 4 ways we can come at you with ozone, and we do it every which way. And sometimes when patients are in the clinic, Dennis, we do all 4 things to them.
All
Everything.
4 things, and on the same day, within the same appointment.
Sure.
Because this ozone is so safe, you take the administration as the patient presents to you, and the more exposure to the ozone they get, the greater chance for therapeutic benefit. Just a word or 2 more about the you call it major autohemotherapy, which was we spent an entire show on last time. It looks to be like the staple way that that ozone is administered medically for just about any disorder. Any issues that you could let our listeners know, sort of a recapping on the major autohemotherapy component before we get to what I believe to be the real creme de la creme today, which is the prolozone?
I don't. Other than just reviewing that process, which is the one I just mentioned, where you take the blood out and put it into the bag and inject the ozone in, and then return the treated blood back into the patient. That's sort of one of the many standards that we use. It has every modality of ozone treatment, whether it's the sauna method, the colonic method, or this major autohemotherapy method. They all have their own different characteristics. So if I were to treat somebody with the major autohemotherapy, I'd get a certain characteristic from that treatment. If I would treat them with the sauna therapy, I get a different characteristic. There'd be similarities, of course, but kind of a different characteristic, and the same for treating them with a colonic. So that's why we often use all three therapies at once, because we're going to get several different characteristics and cover more bases with that particular patient and increase the likelihood of a healing in that particular issue.
Okay. Now, I want to move today to the excitement is in the air. I have had so many calls from listeners who say, I've heard your shows with Dr. Shallenberger, and I have this kind of joint problem, or I have arthritis, and I have this, and I'm really interested in that prolozone. I said, you got to dial us up on April 4th. So plenty of people were out there listening to us today, Doctor, waiting to hear about this issue that you developed it, you invented it. How did it come about that you conceived the concept? This is going back to 1995, almost 20 years ago now, and it's been out there with the people that you've trained. What led you to put this combination together? And I'll let you describe what that combination is and how you came up with it.
Well, thanks. It's an interesting story, and it exemplifies what I think many doctors will tell you who've been around for a long time. When you're a doctor, you go to medical school, you get your training, you finish up with your training, then you go out into the real world, and you start applying your craft, and you very soon realize, boy, they didn't teach me everything that I really needed to know, and you have to learn more. And one of the major ways doctors learn more is through their patients. Our patients teach us things in many different ways, and that certainly is what happened with this particular process, because way back in 1984, I heard about ozone therapy. At that point, nobody in the United States was doing it, but I heard about it because the Germans were publishing papers, and I thought it was fascinating, so I went over to Germany. I took a training session over in Germany, and I came back home. And as part of that training session, even though they didn't teach me how to do it, I remember them mentioning that if a patient has rheumatoid arthritis and they get a very inflamed, swollen knee joint, one of the ways to treat that was to inject ozone gas into the knee joint. And so I just remembered that. I thought, well, that's very interesting. And so when I got home, it was within a matter of a few weeks, a woman comes into my office with rheumatoid arthritis, with very inflamed, very swollen knee joints. So I told her a little bit about what I just learned. I went ahead and I injected the ozone into her knees. She calls me back the next day and she says, "Doctor, I don't know what you did, but it's wonderful. My knees are half the size." We injected her again. Within a matter of 2-3 injections, her knees were totally normal. And this happened over a period of about 2 weeks. And it was just remarkable.
She had a diagnosis of rheumatoid arthritis with joint deformity, I'm going to say, or at least a lot of swelling. And in one treatment, you got the pain to go.
Absolutely. So it's a remarkable thing. We have nothing like this in modern medicine. So what you know, about a month or so later, another woman shows up in my office, and she says, "Doctor, I'm this first patient's neighbor, And my knees hurt too, so I want you to treat my knees like you treat hers, because it worked out so well. And I told her, I said, you know what, your neighbor has rheumatoid arthritis, you have osteoarthritis, you have kind of arthritis that so many people get as they get older. And I told her, you know what, I was trained to use this with rheumatoid. There's no reason for me to believe it's going to help you at all. And she said, well, I just have a feeling it's going to help. And I kind of argued with her a little bit. And finally she said, you know what, here's the thing. Is it going to hurt me? And I said, no, but I can tell you one thing. It's not going to hurt you. She says, try it then. Just try it. I said, okay, I don't have a problem with it. It's totally safe. The worst that's going to happen with this woman is it's not going to work, and she wants me to try it. So I gave her treatment to this old woman's osteoarthritic knee. And darn if she doesn't call me back the next day and say, my knee is great. Well, I ended up giving her 3 or 4 treatments over a course of several months, and darn if her knee didn't get completely asymptomatic. This was a woman who was told by the orthopedist that you need me to put in a total knee into that knee. That's the only way you're going to get any relief to this condition. And so after that experience, Dennis, I just scratched my head and said, you know, I don't really know what's going on here. Which I didn't at the time. But something is going on. This woman has no pain, her swelling's gone, and something went on. So based upon that experience, I tried other things. I thought, well, if it helps the knee, maybe it'll help a back, maybe it'll help a neck, maybe it'll help a carpal tunnel, so forth and so on. And over the next 10 years or so, I discovered that when you inject ozone into areas of the body that hurt and or are damaged, it causes a healing most of the time. And so we can go on a little bit more, but that's how it kind of got started. I began to refine the technique, learn other things to do to make it work even better. And back in the early 90s, I started promoting it. So then I thought, I can't just keep this to myself. I got to teach other doctors how to do this. And that's when we started all the seminars.
Well, and you really did do that teaching. So from those meager beginnings with 2 patients, one that you thought it should work for, the other you had no clue, it then evolved over time that the person said, I heard here, and you said, well, why not try it? And one thing led to another, and by the time it was all said and done, you had approached just about every known joint in the body with, I'm going to say, a very high degree of success. Well into the 90s, is that a fair assessment?
Absolutely. And, the funny thing is that I'm just a doctor. I'm just helping people. But it really wasn't until the late 90s that I actually was able to figure out why it was working.
Oh, I'm going to find that out.
For the first 20 years, I just did it not knowing exactly what was going on, just knowing that it was safe, didn't hurt anybody, and it fixed a lot of people. And then in the latter 90s, I finally was able to determine why it worked. So that made a big difference.
Well, you know what? The suspense is killing me and my listeners. Why does it work? How does it work? What's it do?
It basically, ozone does 2 things. One is it reduces pain. So we can talk about some cases of just painful things where there's been no real diagnosis as to what's causing the pain. It has some effect on pain fibers, pain receptors, and the way they work. And it's very complex to get into this, but it has an effect on pain that actually decreases the sensation of pain. So if somebody's got pain from a condition that cannot be cured, it's absolutely incurable, nonetheless, they can find relief from this because it will reduce that.
Fantastic.
Secondly, it stimulates tissues to heal. So, for example, the best example I think the audience would understand is an osteoarthritic knee where the cartilage is gone, and the doctor says, you have no cartilage that we can see on the X-ray or on the MRI, and you need this knee replaced because there's not enough cartilage in it to take care of the joint. And what it does is it'll stimulate the body's healing properties to the point that the body will actually start to regenerate damaged cartilage, regenerate damaged ligaments, regenerate damaged meniscus, regenerate damaged bones. So it works in those 2 ways. It gets rid of pain and at the same time stimulates the body to heal. just absolutely remarkable in what we see it do.
Certainly in the disorder, the rheumatoid arthritis, with the kind of deformities that joints can undergo, I mean, you couldn't help but to say this is a condition that doesn't appear like it's going to have any resolution, and to learn that in just about all cases, these people respond in the two ways you just described. At some point, you coined the term prolozone. Now, there's a word out there called prolotherapy, and this is not prolotherapy. I'd first like you to make that distinction between the difference of the two, and then how it is that you came up with a concept of a prolozone where you combine ozone with other items, most specifically homeopathic remedies.
Mm-hmm. Yes. So, while all this is going on, I had been trained on this technique you just mentioned called prolotherapy. Prolotherapy is a treatment in a way sort of similar. At least it's similar in the way it looks. Somebody has a bad knee or a bad shoulder or a bad back or one of these things, and you inject liquid substances into those areas. The liquid substances cause an inflammatory response in the body, which means that it hurts a lot, typically. And then when the inflammation has died down, though, that the body responds to that inflammation with a healing effect. So you often get a healing in ligaments and in bones and such from that sort of a treatment. That's called prolotherapy, and I had learned that, so I knew about all the injections and such. When I first started using ozone, I thought it was some version of prolotherapy, so I called it prolo-ozone. Prolo, by the way, it comes from the Greek word that means to proliferate or to encourage the body to heal. So it seemed like a natural. We're using ozone to encourage the body to heal, so that's why we named it prolozone. But the difference between prolozone and prolotherapy, even though it looks the same when patients get it, the difference is really remarkable. Prolozone works much better in cases where prolotherapy fails. Prolozone will work because it's a different modality. In prolotherapy, you're putting in inflammatory type of substances that create an inflammatory reaction. In prolozone, we're putting in oxygen. There's no inflammatory reaction, so there's no pain. And in fact, pain is immediately, within a matter of minutes, lessened, often dramatically. And when you put oxygen into the area, you dramatically and immediately cause it to heal. So in the early days, the way I was taught in Germany is you just inject ozone gas into the knee or whatever part of the body it is. Well, here's the problem. It hurts. It absolutely hurts like that.
The injection itself hurts.
Yeah, the injection, ozone gas hurts. I've injected my leg muscle with ozone, and for about 3 or 4 minutes, you have a lot of pain. Now, after 3 or 4 minutes, it dies down, and then the original pain you had is gone. But those first 3 or 4 minutes are pretty rough. So in the early days, I was giving this to a woman I'll never forget. She after her first injection, she came back. She said, that really worked great, but here's the thing. It really hurts. Can't you do something about that? And she said, can't you, put some Novocaine or something in there before you do it? And I thought to myself, you know what? That sounds like a pretty reasonable idea. I can't see any reason why I shouldn't. So I developed this technique where before I put the injection of ozone in, I pre-inject it with some Novocaine. That worked out great. It didn't change the effect of the therapy. The therapy was every bit as effective, and it didn't hurt. Well, after that, I got to thinking, and I started thinking. Now, this is almost 10 years later, Dennis, when I'm finally figuring out how it's working, and I'm figuring out it's working through its effect. Since it's oxygen, it's working through its effect on the mitochondria in the cells. Those are the areas that use oxygen. And so I started asking myself, what do mitochondria need to use oxygen better? And the answer is B vitamins. That's the major thing. The other thing is sugar. Mitochondria use sugar to heal better. So I thought, I'm putting in the procaine. Why don't I add into that mixture a little sugar, add a little B vitamins, and see if that doesn't make the process work better. So that's what I did. And that's basically the birth of this technique called prolozone, where you pre-inject an area with a solution that makes the cells use oxygen better, and then you inject the oxygen in the form of ozone. And that combination really has worked dramatically well for me.
You have just enlivened a whole group of our listeners who've been suffering with various joint anomalies and discomfort for so doggone long. And you dangled that thing out there in the previous shows that we've done, and to know that today was the day we're going to deal with it, and that these therapies are really going to be available to them now. They are just giddy out here. They're pinching themselves, Doctor, because of the work that you've done. Groping initially as you did, you've refined this and you have taught so many. And I'm going to be involved with your next teaching event sometime at the end of April out there. I'm coming out to see you, Doc, and I'll be looking forward to increasing my knowledge of doing these injections just as you described them. Some substantive questions about the prolozone therapies. First of all, I'm amazed that people with this long-standing kind of pain and discomfort, in one injection, and I marvel over the fact that one injection gives them pain relief, major pain relief, immediately, and well into the 90% of the cases. I'm going to ask once again because it's almost unbelievable to think that that's possible.
It is. It is hard to believe, and that's actually one of the problems I have. Patients will come in and, they'll say, I've heard about you for 3 or 4 years, but I never believed that any of this would work until, I found out from somebody else that had it that it just worked for them. So here I am. Most of my patients I get are, patients that have been already told there's either nothing that can be done for you or you need some sort of really difficult surgery. And so they come in to see me just in the hopes that it might work. I don't get a whole lot of patients that just from the very beginning come in right away. I wish I did, because the earlier you get any treatment, the better it's going to work. So I do get a difficult group of patients. So, I'm on a mission, and you know that. And I've been on a mission since the early 90s. It breaks my heart when patients come in to see me who have been suffering for 10, 15 years. I mean, suffering, addicted to narcotics, on disability. Everything's ruined in their life or affected in some way, shape, or form by this chronic pain. And just to have them walk out of my room after about 35, 40 minutes worth of treatment with tears down their face saying, I can't believe that I've been suffering this long and you just took my pain away for the first time.
Wow.
It just shakes you. As a doctor, you see that, and it just breaks your heart, and you think to yourself, people have to know about this. We have to get this word out. We have to teach doctors all over the country. In every city, there has to be at least one doctor that patients can turn to for this kind of treatment. So that's been my mission, and I'm happy to say with the Academy now we have 160-some-odd members. There's even more doctors using it in this country that aren't yet members. But, I mean, that's a lot. 160 doctors spread around the country is pretty good. But my mission is to get thousands of doctors learning this. Right
on, Doctor. And your mission is well in play. Never mission accomplished with you. You're never going to rest on your laurels. You'll be promoting this as long as you're practicing medicine, and even then some.
Obviously, yes. Yeah.
The relief so quick. Follow-ups. Give my listeners an idea of how a typical case goes. Do they do these treatments pretty aggressively initially? Do they do them? They space them out, one a week, one a month. Give a listener an idea of how that may work in your office.
Typically speaking, and every case is different, so we can alter things according to the merits of that case. But typically, after the initial treatment, I see the patient back in 1 to 2 weeks. At that point, what's going to happen is their pain is going to be decreased, their situation is going to be improved, at least, say, 20%, very at least at 20%. Each time I give them a treatment, they incrementally heal some more. So it doesn't happen all at once by and large. So they come in, I see them back in a week or two, their pain is 20% less. Sometimes it's a lot more than that, but that's the minimum that I want to see. If it's not, and it's not always, so if it's not, then I'll change my technique a little bit, and I keep adjusting the technique until I find exactly what works, because there's with each patient, sometimes you have to try different things. But once I get to the point that I know for sure what we're doing, I'm going to treat that patient about, so I'm going to see him at the 1 week interval, give him a second treatment there. After that, and I'm sure that I know what I'm doing and exactly what treatment is required for that particular condition they have, then I'm probably going to see them at 4 to 6 week intervals until they're as good as they're going to get. Now, for roughly 80% of people, that means completely healed.
80%, another number that's staggering.
Yeah, it's nuts because, like I say, these patients I get are the really hard ones. I believe if I got patients early in the game, I'd probably be closer to 100%. But 80% of them are going to be completely healed. That might take 4 or 6 treatments over, say, 3-4 months. The other 20% are not going to get healed. We're going to get to the point where we've given 5, 6, 7 treatments, and they're going to tell me, you know what, I'm a lot better, but these additional treatments don't seem to be allowing me to be completely healed. At that point, we stop trying to go for a heal, and we just want to put them in a maintenance position so we make sure their pain doesn't come back and get worse again. Because they're a lot better, they're just not completely healed. At that point, I might see them, say, twice a year, there on out, just to keep things at a steady state.
Perfect. Now, the use of, do you combine major autohemotherapy? Somebody coming for joint dysfunction and joint pain, is it atypical for you to say that you can benefit from doing major autohemotherapy in conjunction with prolozone?
Well, it's a good point. So what other therapies can be helpful at the same time? Most of the patients I see are either young people who are athletes and need to get back into the game very quickly, or they're just old folks, and they got bad knees, they got bad necks, life has injured something along the lines, and as we get older, this shouldn't be too shocking for anybody to think about, but as we get older, guess what? We don't heal so well. There's lots of reasons for that. One of them has to do with this idea of we don't use oxygen so well, and since ozone works on that level, that's one of the reasons it works so well. But there are other issues. So one of the reasons people don't heal as well as they get older is because their circulation is bad. Ozone treating through the blood can fix that. Another reason that patients don't heal as well as they get older is because they lack hormones. So I'll actually prescribe hormones for some of my patients. So it's true. Somebody might come in with 2 really bad knees, and in that case, I might say, you know what, your circulation's really impaired. Maybe they have heart disease. Maybe they have hypertension at the same time. I'll say, why don't we go ahead and treat that? Let's treat your circulation. At the same time, we're treating your knees. And, oh, by the way, your hormones are in the tank. How about we bring you up to snuff on your hormones? And by doing that, we're going to get a lot better result than if we hadn't done those.
Okay, gotcha. Got a specific example I want to give you. I promised the patient that I would pose this because I think it's something, for me as an anesthesiologist treating chronic pain for a career now, a patient comes to me frequently with this kind of a presentation. They've developed, let's say, back pain. They've been assessed by orthopedics, and they have been recommended to have a surgery that they do not want, and that they're grasping and groping for a way to get relief without that surgery. I'm going to guess that kind of patient is certainly one that you're no stranger to. And in that setting, how have you found that prolozone can rescue people even when there are clear-cut surgical indications and you've been able to spare them that surgery? Has that happened?
Oh, it happens all the time.
All the time. I love for you to say it that way, Dr. Shallenberger. All the time, huh?
What people need to realize is before this kind of thing came along, if you had bad knees, say, for example, or a bad back or something, the doctors would give you physical therapy or they would give you pain pills. And the next step, if those things weren't effective enough for you, the next step is surgery. That's a dramatic step. So patients need to think of prolozone as being something in between those things and surgery. In an ideal world, nobody in pain should ever have surgery until they've been treated with prolozone and it's been found to be ineffective. There are undoubtedly some cases that require surgery. I have sent some cases to surgery, but never until we try the prolozone technique first, because majority of them are going to get substantial benefit, if not a complete cure, from the prolozone. Now, don't expect your orthopedist to tell you about this. Of all the doctors that we have in the country that use prolozone, only 2 of them are orthopedists. It's not shocking to understand. Orthopedists have trained all their lives to operate. They're not interested in doing prolozone. They're interested in taking patients who can't get well any other way, including prolozone, and operating on them. So we need doctors like that. But just everybody listening ought to understand, when they go see their orthopedist and they say, what can you do for me? His answer is going to be surgery, physical therapy, or pain pills. Almost none of them know about prolozone. So don't take that as an answer indicating that prolozone won't work for you. They just don't know about it.
Well, not that you're known pussyfooting around. You have dealt with this one head on. Never go to surgery without at least trying prolozone first. And just as a percentage, in that particular setting, how frequent is it that the surgery has been able to be avoided? We well into the 80s and 90% of the time?
Oh, yeah. If I see 20 patients, if I see like 30 patients for, say, low back pain, I might send one for surgery.
1 out of the 20 or 30?
I want to say 1 out of 30. It's pretty infrequent that sometimes I'll send a knee in for surgery. That occasionally happens. So I remember once I had to send somebody in for a hand issue, but it's awfully rare.
And I guess the same thing would be said for joint replacement. And the hip, I'm going to guess, is probably the number 1 and the knee number 2. In the setting where the insistence on the part of the orthopedic surgeon is to completely replace the joint, are you finding similar ability to allow them to have the non-surgical approach when the prolozone can absolutely return them to function?
Yes, because, when the orthopedic surgeon says you need surgery, basically what he's telling you is physical therapy's failed, the medications aren't all that helpful, and the only thing I know to do to you now is surgery. I don't know how to do prolozone. I don't know how to do anything in between. If you fail physical therapy and you fail medications, the only thing I know how to do anymore is to do a surgery on you. He doesn't know that in-between thing. So people should try the in-between thing. For example, on hips, I would have to say that I probably send half my hips to surgery. Now, why is that? How come I can't heal a hip? I've struggled with this for years. I've talked to many of the doctors that I've taught to inject and treat hips with prolozone. We all have the same. Some of them are, professors at universities, so they're really incredibly good at the technique. And so I know it's not me and my bad technique, because we all struggle with this. And I would have to tell you, Dennis, that hips are the one area that by the time they get to be really a big problem, they are so damaged that about half of them actually need the surgery. Now, we still get a good response on, a good 40 to 50% of them. So I wouldn't, even if you had a bad hip, I wouldn't say immediately go to surgery. Try the prolozone therapy technique, because there's a chance it can help you and avoid the surgery. But the other areas of the body respond remarkably well, but the hips are a bit of a challenge.
40-50% is still wonderful, and I think the message comes across loud and clear. and I'm glad that and you're not known for pussyfooting around. Once again, you're a straight shooter, and these people are dying to hear the message, not watered down. That's certainly 40 to 50%. That's a risk to take. When in fact the real risk happens to be with the surgery, and there's no risk with the ozone. So what's the risk? There is none.
Yeah, absolutely. And here's the other thing too. Let's say you go in and you get some prolozone treatments for your hip and it doesn't work, and you end up going on to have surgery. Those oxygen treatments into the hip have made the bone stronger and the circulation improved. So when you have your surgery, you're going to have a better result. You're going to heal much more quickly and with a lot less pain. You're going to have a better result. So it actually is even a good way to prep a patient for surgery. Just yesterday, now we were just talking before the radio show, but just yesterday I had some dental work done, and the dentist that I use, guess what? He uses ozone in his practice because it takes away pain. So it wasn't maybe 16 hours ago. I had some very significant dental work done, and you asked me how was the pain. You thought maybe I could go show so easily. I feel great. I have zero pain at all. So in this case, he actually did a surgery to me, but because he used ozone prior to the surgery, I healed much more quickly and without any pain at all.
Well, first of all, we're so happy that you had what I thought might even need to cancel this show this morning, not knowing how invasive the procedure was. My guess is it was pretty invasive, and the ozone won out again. And so you live by the sword and you die by the sword. Thank God we had a dentist that you could go to that was trained in the use of ozone, and you deserve that benefit, Dr. Shallenberger. You've helped so many. Nice to hear that you can be helped yourself.
One of the great things about our academy, and the listeners would be interested in this too, is we have a lot of veterinarians because, I could tell you some incredible stories about how ozone has helped animals, and horses. And we also have dentists, and ozone is an incredible thing for dental problems and dental pain and dental issues, both on the healing side, like with me, they do a surgery and there needs to be some healing, but also on just the chronic pain side. You can take away dental pain, facial pain, all those kinds of terrible pains that some people suffer with for many, many years using this technique in a dental application.
Goodness gracious. Doctor, we are coming to the end. This was the final show of 3. Not to be your last show here. We're going to bring you back hopefully once a quarter to just update us, and I hope you'll consent to being invaded. I thank you so much for allowing us to invade you 3 times out. You have really made a lot of people happy here in the western Pennsylvania area. We'll be talking much, Doctor. I just want to thank you once again for all that you have done in this arena. There's more to do, and you're on a mission, and who didn't know that? Thank you so much, Dr. Shallenberger.
Thank you, Dennis, for the opportunity to share this with your listeners. I really appreciate it, and appreciate the good work you do in helping us to get this information out, too.
All right, there you have it, folks. Dr. Frank Shallenberger, the godfather of ozone therapy. Don't forget, on Monday, Thomas Levy here talking about calcium and how it's not all cracked up what it used to be. Till then, Dr. Dennis Courtney with Dr. Frank Shallenberger saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D. 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 M.D.